In this video, we will address commonly asked questions and myths about bone and joint pain, suggest some ways to manage and give you helpful resources. Bone and joint pain can be a common side effect of blood cancer and treatment. It can affect your quality of life and relationships, mood, thinking, ability and desire to do the things you love. Your treatment team will work with you to minimise and manage any pain or discomfort you are experiencing. It is important to remember that pain is a very individual experience and symptoms should be discussed with your treatment team. Pain or discomfort is a general symptom of many blood cancers and may occur in the joints or bone marrow. There are many reasons why you may experience pain. Some medications, for example, growth colony stimulating factor, commonly known as G-CSF, and bisphosphonates. Common medical conditions, arthritis, osteoporosis, inflammation, infection, cancer and its treatment, radiotherapy and chemotherapy, steroids and some immunotherapies. Your individual experience of pain and discomfort will depend upon your diagnosis and treatment. Some myeloproliferative diseases experience foot and leg pain due to reduced blood flow. Myeloma can weaken bones and increase the risk of experiencing a fracture. Some blood cancers cause cancer cells to accumulate in the joints, causing pain and swelling. Bone marrow is the spongy part of large bones that produces all the different types of blood cells. Bone marrow can become full of cancer cells, which can cause pressure and pain in the bones. This is commonly associated with leukemia and myelodysplastic syndrome, also known as MDS. G-CSF stimulates the bone marrow to produce infection-fighting white blood cells. This can also fill the bone marrow with extra cells. This is commonly prescribed after chemotherapy or a stem cell transplant. If pain is affecting your ability to do everyday tasks, or you notice any changes in your pain, discuss this with your treatment team. They may wish to do a physical examination, scan or blood test to rule out any reversible causes or adjust your medication. You can help the team to make an accurate assessment by sharing the following information with them. Where is the pain? How long has the pain been present? Is there anything that makes the pain better or worse? When does it happen? Sudden onset? Constant? Only at night? What type of pain is it? Sharp? Dull? Achy? Stabby? Tender? Mild? How much has it affected your ability to do your things? For example, walk, dress, work, drive, sleep. Sometimes it's useful to write down your symptoms in a diary so you can easily spot any patterns like you experience pain, any correlation with treatment or mood, worse during menstrual periods. There is some evidence to suggest that people get relief with gentle massage, acupuncture, yoga and relaxation, though we always recommend consulting with your treatment team first. Doing things that move your attention from pain to more enjoyable activities like listening to music, playing with a pet, painting, watching a movie, or reading. It is common for people to think that bone or joint pain is due to arthritis or a joint injury, which will heal without medical advice. Please seek a medical assessment for any new or persistent pain. If your pain is associated with treatment, discuss this at your medical appointment and ensure you have adequate pain relief during this time. Joints and bones can be affected by the blood cancer treatment and other common conditions: infection, arthritis, osteoporosis, sports injuries, gout, autoimmune disease. It is recommended you seek medical advice to assess the underlying cause of any pain or discomfort. Some complementary therapies can interact with your blood cancer treatments. They may cause unwanted side effects or change the effectiveness of your treatment. It is essential you discuss what you are using with your treatment team.
The pain I suffer is variable both in frequency and intensity. The pain is not curable, but I have learnt that it's possible to work towards reducing the pain, at the same time preserving and maybe increasing movement to live life as fully as possible. Learning how to manage my pain has been the biggest challenge. I've gained information and knowledge through my GPs and specialists about the pros and cons of medications and how they work. The most important decision was to adjust my expectations and those of my family and friends. I realised I couldn't do the things I used to without thinking about it and not getting down on myself for disappointing others, and that's a tough one. I learnt to pace myself by breaking tasks up into 15-minute sections over a period of a day. I constantly moved from one heavy task to a lighter task to increase my physical endurance in my day. I use pacing in just about every aspect of my day, my daily activities, and I know it reduces the extent of my joint and bone pain significantly. Distraction has been an amazing tool to manage my pain. Most importantly, I distract myself with meaningful things, like I like to quilt, paint with watercolours, and I also use exercise as a distraction. Regular hydrotherapy keeps my muscle tone and conditioning at an acceptable level for someone like me with other health issues. I'm computer literate and use those skills for charities where I can. And when I'm distracted, my pain takes a back seat in my brain. Finally, I sought to understand the medications that are available and how to use them in my personal situation.
Balancing rest and exercise is important to avoid making pain worse. Exercise will strengthen muscles and stabilise joints and bones. Seek advice from a physiotherapist to create a safe program that meets your needs. Work on strength and balance. Use mobility aids. Reduce falls risk. Join a falls prevention exercise program. Add some gentle exercise, meditation, mindfulness enjoyable activities into your week. Correct positioning of your body supports joints and reduces pain. Reposition pillows in bed. Have your bed and chair set to the right height. And wear well-fitting supportive shoes. Consider talking to an occupational therapist or podiatrist. Good nutrition helps your body recover and cope better with the effects of cancer and treatment. Pain can lead to changes in memory, concentration and mood. You may find you worry more and withdraw from people or activities you enjoy. Seek support from someone you trust. Keep your treatment team up to date with your pain level and report any changes. Continue prescribed medications even if pain resolves. Seek a referral for persistent pain from palliative care or pain management team. Regular health checks or early detection and management of symptoms, for example, to assess bone density, pain levels and medications. Access professional help for long-term management of bone and joint pain. You may be eligible for a general practitioner management plan through your local doctor.